Chickenpox. Chickenpox is an infection caused by the Varicella zoster virus. It is highly contagious to people who haven't had the disease or been vaccinated against it. It affects all age, sex, and race equally. The source of infection is the nasopharyngeal secretion and the skin lesions. The incubation period lasts from 14 to 16 days, but the infectious period is from 5 days before to 6 days after the last crop. The mode of transmission is the droplet infection as well as the direct contact. Clinical features. The clinical features can be divided into different phases. The prodromal phase usually lasts for 1 to 2 days. Then, exanthematous phase takes place. In the exanthematous phase, the erythematous, macule, and the vesicles develop on the first day. Then successive crops, eventually from macule, papule, vesicle, pustule to crust, progress from 3 to 4 days. It is centripetal in distribution and ranges from around 10 to 1500. In case of the progressive varicella, the internal organs are also involved. The involvement of the internal organs are more in the immunocompromised state. Therefore, it should be treated with the acyclovir, which is the antiviral drug. Neonatal varicella develops if the neonate is delivered 1 week before or 1 week after the maternal varicella. It is usually very severe. The treatment with varicella zoster immunoglobulin with acyclovir should be given. Congenital varicella syndrome. If the mother between 6 to 20 weeks of pregnancy is affected, around 25% of the neonate is affected by it. If the mother becomes affected between 6 to 12 weeks, the lymph development is involved. And if the mother between 16 to 20 weeks is affected, the eye and the brain gets involved. There are various manifestations of congenital varicella syndrome. The first is damage to the sensory nerve. Here, characteristic cutaneous lesion with zigzag scarring develops. Also, hypopigmentation develops. Second is the damage to the eye, which results in microphthalmia, cataract, chorioretinitis, or optic atrophy. Also, damage to the limb causes severe malformation of the extremities. Also, there is damage to the limb by malformations of the extremities. Fourth is damage to the brain, cervical or lumbosacral cord, and other manifestations include microcephaly, hydrocephaly, calcification, aplasia of the brain, absence of the deep tendon reflexes, Horner syndrome, anal urinary sphincter dysfunction. For fetopathy, there is no role of postpartum antiviral drugs. Diagnosis. The diagnosis can be done by identification of the clinical features. Another is by the isolation of the virus, also by using of the rapid PCR technique. Treatment. The role of acyclovir is there when given within 48 hours of onset of rash. The indications for acyclovir include immunocompromised patients, pregnant women, chickenpox with complications, and neonatal chickenpox. The complications of the chickenpox include pneumonia, encephalitis, cerebral ataxia, viral hepatitis, rarely, purpura, hematuria, GI bleed, nephritis, HUS, arthritis, myocarditis, pericarditis, pancreatitis, or orchitis can be there. Thank you. Please do like, subscribe my channel and share this video.